everyone, and welcome to our Question Lab. This evening's topic is biochemistry, and tonight's discussion will be led by Dr. Paras Vicaria, and Paras is going to introduce himself now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then went back home to Michigan and finished medical school. I also am working with USMLE-Rx as an RX coach. So I work one-on-one with students to help prepare them for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
Throughout the evening, as we dissect 4 questions on biochemistry, will be the same process that we use in RX Coach. So without any further ado, let's go ahead and get into our first of 4 questions on biochemistry. As you can see, the answer choices are not there, and that is by design. We do that on purpose because we do not want the answer choices to guide or dictate your thought process, and we don't want you to see an answer choice that you're unfamiliar with that may cause you to panic as you're trying to answer the question. So I've gone ahead and removed those answer choices for you. Once we cover up those answer choices, we will begin by reading the lead-in. So let's do that now. The lead-in, for those of you wondering, is the last sentence or the question itself. So here we go. The rate of which of the following enzymatic conversions is most likely increased in this patient? The rate of which of the following enzymatic conversions is most likely increased in this patient? So once we read the lead-in, we'd like to ask our students how many steps they believe this question will require. Now, why do we read the lead-in first? We read it first because we want you to know what the test writer is asking, so that when you read the vignette, you can go ahead and pick up on all those relevant clues and not have to reread that question and waste valuable time on test day. Why do we ask you how many steps this question requires? That's because we want you to have an organized thought process so that you do not make any careless mistakes on test day and maximize your potential and your score. So an example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. An example of a 3-step question could be where you're asked for the mechanism of action of a treatment for a diagnosis. So with that in mind, please let us know in the question box how many steps you believe this question will require, and then we'll go ahead and move on and read the vignette. I see some responses coming in. Let's go ahead and read that vignette. A 74-year-old man is brought to the emergency department because of lightheadedness, weakness, increased thirst, and increased urination. Symptoms began 3 days ago when he started taking prednisone to treat arthritis. Laboratory studies show a glucose level of 294. The rate of which of the following enzymatic conversions is most likely increased in this patient? So I'll give all of you a few moments here to start thinking about the relevant clues in the vignette and lead-in as I hand it off to Paras. Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and walk you through what we think are the important clues in this vignette and the lead-in. So starting off, demographics. So most questions start off with demographics. And in this question, again, it's important to make note of that, okay? How old are they? And then also, what brought them into the hospital, the ER, the clinic? And in this case, it was a few things: lightheadedness, weakness, thirst, urination, okay? Hopefully that's making you start to think of a few things as well. You know, then they gave us some more important information, like when did these symptoms begin? Always important to make note of the duration. So how long has it been going on? Were there any temporal factors associated with this? In this case, they said it was around when he started taking prednisone. And then they gave us some important lab value. That's important to take note of here as well. So then in regards to the lead-in, they're asking us specifically the rate of which enzymatic conversion is most likely increased. So how many steps is this question? Well, one, I think we need to know kind of in the broad sense what's going on in this patient. And 2, you know, how is that happening? So, you know, they're telling us this is something enzymatic. So 1, what's going on in this patient? And then 2, you know, from a biochemical level, what's happening? So probably a two-step question here, okay? Let's go ahead and take a look at the answer choices. And as you can see there, we have 5 answer choices. So what we're going to do is we're going to go ahead and read those off to you. But what we recommend is that students actually start at the bottom, answer choice E, and work their way up to the top. So we'll start from answer choice E at the bottom and work our way to answer choice A at the top. Sometimes what we see is students, will start at the top, they'll work their way down, they'll see something they'll like, and they'll select it without having gone through all the answer choices. So doing it this way helps prevent you from biasing yourself. So let's go ahead and do that now. Answer choice E, pyruvate to acetyl coenzyme A. D, phosphoenol pyruvate to pyruvate. C, oxaloacetate to phosphoenol pyruvate. B, malate to oxaloacetate. And A, glucose to glucose 6-phosphate. So we're going to go ahead and open up that poll. Go ahead and select the one that you think is the most likely correct answer in this question, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. So once again, the poll is open for our first of 4 questions on biochemistry. We'll wait until about 2/3 of you have responded until we move on. Now, keep in mind that there is no penalty for guests. Never leave a question blank. And if tonight you're unsure, don't worry. Take your best guess, and then we will review the correct and incorrect answer choices afterwards. For those of you just joining us, please do keep in mind that we have a raffle and a special offer. You must be present to win, so make sure you stick around. I see the responses coming in. We'll give all of you a few more moments here. Seems to be a clear favorite so far. All right, let's take a look and see what all of you selected. And it looks like the clear winner here with 40% was C, oxaloacetate to phosphoenol pyruvate. And in second place was glucose to glucose 6-phosphate. Let's take a look and see what the correct answer is. And the correct answer is indeed C, and 40% of you got it right. So well done to those of you who got it correct. Let's make sure you got it right for the right reason, though. And if you didn't get it right, don't worry. We're here to learn, and hopefully, if you'll listen to Paris now, you'll knock it out of the park on test day. Paris.
Thank you, Sean. Great job, guys. Great way to start off the session. So we know that this patient has a very high blood sugar level, right? We also know that they have certain signs and symptoms of hyperglycemia, increased thirst, increased urination. Why is that the case? Well, hopefully you guys picked up that it was probably the prednisone. So glucocorticoid-induced hyperglycemia, okay? So glucocorticoids can cause hyperglycemia, we know that, but what's the mechanism? The mechanism is it promotes gluconeogenesis, okay? Specifically gluconeogenesis in the liver, and it promotes insulin resistance, okay? So in the gluconeogenesis pathway, phosphoenol pyruvate, PEP carboxylase or carboxykinase, is an enzyme that converts oxaloacetate to PEP or phosphoenol pyruvate, okay? And on the next slide, Sean has actually gone ahead and pulled up a figure from first aid that's the summary of the biochemical pathways. If you take a look at number 16 there, going from oxaloacetate to phosphoenol pyruvate, you can see that this enzymatic step is in the light pink box of gluconeogenesis, okay? So this is a gluconeogenic reaction or step, okay? So glucocorticoids would promote this step. They promote gluconeogenesis to increase, and as a result, you get increased blood sugar like our patient, okay? Now, let's take a look at the next slide. On the next slide, and it's actually a little bit more in-depth on specifically gluconeogenesis, and you can see there that PEP carboxykinase or carboxylase is what converts oxaloacetate to phosphoenolpyruvate, confirming our suspicion that this enzyme is part of the gluconeogenesis pathway, okay? So let's go back to the vignette and the answer choices, okay? And here we'll start with the other answer choices, and hopefully you'll start to get a sense of why these are less like, not as good answer choices. So answer choice E, the enzyme that converts pyruvate to acetyl coenzyme A is pyruvate dehydrogenase, okay? This forms acetyl coenzyme A so it can enter into the citric acid cycle or TCA cycle, okay? This is not part of gluconeogenesis. Answer choice D, this step from PEP to pyruvate, that is catalyzed by pyruvate kinase, okay? And this is actually the final step of glycolysis, so the opposite of gluconeogenesis. Answer choice B, malate to oxaloacetate, this is done by malate dehydrogenase, and this is part of the TCA or citric acid cycle, so also not part of gluconeogenesis. Lastly, answer choice A, this is done by either hexokinase or glucokinase to convert glucose to glucose 6-phosphate. And also, this is the first step in glycolysis, so the opposite of gluconeogenesis. So hopefully, you guys are able to see that really the only gluconeogenic pathway or step here is answer choice C. So even if you didn't know exactly which step was increased by prednisone, you could take a look and say, well, the only one that would increase glucose in this question would be the gluconeogenic pathway of answer choice C. So there were a couple ways you could have gotten to this correct answer choice, and all are good ways to get there. So hopefully you guys were able to pick up on that, and great job with this first question.
Excellent. Thank you, Paros. Yes, great job, everyone. That was a challenging question. Well, let's go ahead and move on now to our second question of the evening on biochemistry. Once again, the answer choices are covered up. That is by design. And we will begin with the lead-in. Which of the following is contributing most to this patient's symptoms? Which of the following is contributing most to this patient's symptoms? I'll give all of you a few seconds here to let us know in the question box how many steps you believe this question will require, and then we will read the lead-in. All right, I see the responses coming in. Let's go ahead and take a look at that lead-in. A 3-year-old boy is brought to his pediatrician because he is having difficulty breathing. His mother states that he has recently had a mild upper respiratory infection, which has since resolved. On physical examination, the boy has a temperature of 99 degrees Fahrenheit, or 37.2 Celsius, heart rate of 95, blood pressure of 110/75, respiratory rate of 33, and oxygen saturation of 94%. The boy appears to be having trouble breathing, and on lung auscultation, wheezing can be heard throughout the lung fields bilaterally. Which of the following is contributing most to this patient's symptoms? I'll give all of you a few moments here to start thinking about the important clues as I hand it off to Paros.
Thank you, Sean. So once again, we are going to go ahead and show you what we think are the important clues in this vignette and lead-in. So now we have a younger patient, 3-year-old boy, so we need to start thinking about pediatric issues, okay? Why did he come to his pediatrician? Well, he was having difficulty breathing, okay? They then also gave us some important temporal relationships. Recently had a mild upper respiratory infection. They give us some vitals, some physical exam findings. We can tell this is kind of a little bit, respiratory focused. So it's important to make note of those respiratory signs and symptoms and clues in the vignette, which is what we've done there. So then they're asking us what is contributing to the patient's symptoms, okay? And in fact, I didn't highlight this at first, but I would also highlight most. So what is contributing most to this patient's symptoms, okay? It's not just what is contributing, but there could be a few of those answer choices that are contributing, and it may be up to us to decide which one is contributing the most. So like Sean highlighted there, that's also important there as well. So let's go ahead and take a look at, well, first let's talk about how many steps is this question. I think one, we probably need to figure out what's going on with this patient, maybe what's the diagnosis or similar. And then two, which of those is contributing to those, the symptoms. You could argue that an added third step would be maybe figuring out which, if there are a few things contributing, which one contributes the most. So at least two steps with the question and the lead-in, and then maybe another added step of needing to figure out which one contributes the most. So let's go ahead and take a look at those answer choices. And once again, we will start at the bottom and we are going to work our way up to the top. Answer choice E, prostaglandin E2. D, prostacyclin. C, leukotriene C4. B, leukotriene B4. And A, cyclooxygenase. So we're going to go ahead and open up that poll. Go ahead and select what you think is contributing the most to this patient's symptoms, and we'll talk about it in just a few seconds.
Excellent, thank you, Paura. So once again, we're going to give all of you a few moments here. And we'll wait until about 2/3 of you have responded before we move on. For those of you just joining us, please do keep in mind that we have a raffle and a special offer for those of you that are in attendance this evening. You must be present to win, so make sure you stick around. I see the responses coming in. We'll give all of you a few more moments here. All right. Well, let's take a look and see what you selected. It was close. 38% of you selected leukotriene C4 and 33% of you selected leukotriene B4. Let's take a look and see what the correct answer is. And the correct answer is C, leukotriene C4. And 38% of you got it right. So another challenging question. Let's pay attention to Baruch now so he can explain it to us. Baruch.
Thank you, Sean. Great job, guys. Yes, another good question here. So let's take a look at what's going on. We know this kiddo has tachypnea. Okay, he's breathing at 33. He's got a slightly decreased oxygen saturation. So we know this is a pulmonary process, okay? He's also got diffuse wheezing throughout the lung fields bilaterally. So, this could be saying that maybe he has asthma, okay? Especially in the setting of a recent mild upper respiratory infection. So he could be having a mild asthma exacerbation, okay? As we know, viral URIs are often triggers for asthma exacerbations. So what's going on in patients with asthma or other respiratory diseases like that? Well, we know that there's chronic inflammation of the airways. We get smooth muscle contractility, we get increased mucus secretion, and this ends up causing an obstructive lung disease, okay? Leukotriene, certain leukotrienes, specifically leukotriene C4, D4, and E4, are bronchoconstrictors, okay? So let's take a look at the next slide. Sean has gone ahead and pulled up a nice figure from first aid. You can see there how the precursor is membrane phospholipids, and that eventually becomes arachidonic acid. And you can see there, depending on which enzyme converts it, it can either be converted by 5-lipoxygenase into leukotrienes, or by cyclooxygenase into prostaglandins, prostacyclin, thromboxane. So you can see that split there in the middle. Hopefully you can see on the bottom left that leukotriene C4, D4, and E4 are all bronchoconstrictors. They increase the bronchial tone, okay? Leukotriene B4, well, that has to do with neutrophil chemotaxis, okay? So not as much of a role here. Some of the other answer choices, prostacyclin, okay? You can see that that has to do with decreasing platelet aggregation, decreasing vascular tone, not what's going on here. And then prostaglandin E2, that has to do more with uterine tone, okay? The last answer choice was cyclooxygenase. So hopefully you can see that cyclooxygenase doesn't really contribute to leukotriene production. It's 5-lipoxygenase that does, not cyclooxygenase. So you can see there's actually a drug called xyluton that can inhibit that formation of leukotrienes in patients who have respiratory diseases like asthma. Okay, there are better drugs for asthma, but this is one therapeutic option, and that's exactly how it works to decrease those leukotriene levels. So let's take a quick look back at our question, our vignette. Hopefully now, by looking at the other answer choices, you can see why those are all incorrect. Either they're on the right side of that pathway, or it was leukotriene B4, which has to do with neutrophil chemotaxis. So great job on this question as well.
Excellent. Thank you, Paros. Yes, great job, everyone. That was a tough question. I want to take a brief minute to talk about RX Coach before we move on to our third question. If you're thinking to yourself and you're putting in a lot of time studying, but your results aren't matching your efforts, you feel like you're not progressing at the pace that you want somebody to walk you through planning your studying and make you a solid study schedule and a study plan, hold you accountable, work with you to identify your knowledge gaps, your strengths, your weaknesses, work with you one-on-one to enhance those test-taking skills. RX Coach is here to help. Whether you're already doing great and you want to do better, or you're not doing anywhere compared to where you want to be and you still want to do better, we are here to help, okay? We start off with a 160 question assessment if you're studying for your board exam or if you're studying for comp. If you're still in school, we'll base it off of your syllabus. We'll create a personalized study plan, use our one-on-one approach, and use our highly trained RX certified tutors, and you will of course get access to all of our resources as a result with every single coaching package. Now, there are a lot of coaching companies and tutoring companies out there and USMLE programs out there, but a couple of things to keep in mind. If you're signing up for a USMLE prep course, keep in mind that the individuality of you as a student will go out the window, right? Because everybody's doing the same thing at the same time, and you're expected to all learn at the same pace, okay? This is different. We cater this to you, so you learn at the pace which is best for you. As far as other tutoring and coaching companies go, I encourage you to look into our reputation, to look into how long we've been in medical education before we started tutoring. We've authored our own assessments. We've come up with our own resources, some of which are extremely popular. USMLE-Rx, the book First Aid, right? Bricks, Express videos, Flash Facts. So we use a lot of that data that we've learned over the last several decades to help you take a data-driven and progress-based approach. So if you're interested in learning more about RX Coach, you want to talk to somebody to see if this program is a good fit for you, simply go online to rx-coach or rx-coach.com, click on the free consultation tab to talk about the program and how it can benefit you. And we'll be happy to talk to you, let you know how the program works, share some of our success stories with you. And we've had students go up as much as 80 points. Okay, we've had students break 260 that have come to us. So we have a really, really wonderful track record. And as you can see, our students are extremely satisfied, and we'd love to make you one of our success stories. So once again, that website is rx-coach or rx-coach.com. All right, so without any further ado, let's go ahead and move on to our third question of the evening. A couple of reminders. Like I said, we do have a raffle and a special offer. You must be present to win, so make sure you stick around until the end. Next week's topic, for those of you who are asking, is renal physiology. Here we go with our third question of the evening. Once again, the answer choices are covered up, and that is by design. Which of the following enzymes is most likely deficient in this patient? Which of the following enzymes is most likely deficient in this patient? I'll give all of you a few moments here to start thinking about how many steps you believe this question will require, and then we'll move on and read the vignette. All right, I see the responses coming in. Let's go ahead and take a look at that vignette. An 11-year-old boy is brought to his pediatrician by his mother because of recent episodes of lightheadedness, racing pulse, dizziness, and nausea. On physical examination, there is generalized decreased muscle tone, and the liver and spleen are palpated a few centimeters below the left costal margin. Laboratory studies show increased creatinine kinase and decreased glucose levels. Urine ketones are positive with negative glucose. An electromyogram shows features of myopathy. Which of the following enzymes is most likely deficient in this patient? Once again, start thinking about those important clues in the vignette and lead-in as I hand it off to Paris. Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And obviously you can tell probably right off the bat, there's a lot in this vignette, okay? This is another pediatric case, a little bit older, okay? Why was he brought in? Well, recent episodes of lightheadedness, racing pulse, dizziness, and nausea. So it's important to keep in mind why he was brought into the pediatrician. They then give us some important physical exam findings, important to make note of that. Some important lab findings, urine findings, and then they even give us some findings of an electromyogram showing there's myopathy. That's not something you see every day in your vignette, so it's definitely important to take note of that as well. Then they're asking us about which enzyme is most likely deficient in this patient, sorry. So, how many steps is this question? Well, one, I think we need to figure out maybe what's going on in this patient, what's his condition, what's his diagnosis, and then two, based off that, is there an enzyme that's most likely deficient based on the mechanism or the pathophysiology of the disease? So, probably a two-step question here. So let's go ahead and take a look at those answer choices. Once again, we have 5 answer choices, and we are going to start at the bottom and we're going to work our way up to the top. Answer choice E, myophosphorylase. D, lysosomal acid maltase. C, glucose 6-phosphatase. B, debranching enzyme. And A, branching enzyme. So we're going to go ahead and open up that poll. Go ahead and select the one you think is most likely deficient in this patient, and we'll talk about it in just a few seconds.
Excellent. So this is our third of 4 questions this evening on biochemistry. We'll give all of you a few moments here to submit your responses, and then we will move on to a wonderful explanation, followed by our last question of the evening, and of course, our raffle and special offer. I see the responses coming in. We'll give all of you a few more moments here. And if this question looks familiar to you veterans, we've actually done it before, so it should. All right, let's take a look and see what all of you selected. In first place with 34% was myophosphorylase, and in second place with 29% was D, branching enzyme. So let's take a look and see what the correct answer is. And the correct answer is B, debranching enzyme, and 29% of you got it right. A tough question indeed. This is one of those topics that gives students some pause and can be a little difficult to keep straight. But I trust if you listen to Paris now, you'll master it and knock it out of the park on test day. Paris.
Thank you, Sean. Yeah, definitely a tough question and a topic that's very, very important to keep straight and difficult to keep straight, but also very high yield. So what's going on with this patient, as you guys probably figured out, has a deficiency in debranching enzyme, which is for Cory's disease, okay? So what does he have going on? Well, he's got a few things going on. He's got ketone in his urine, or ketonuria, got low blood sugar, we know that. He's got hepatomegaly and actually hepatosplenomegaly. They're telling us it's palpated below the costal margin, a few centimeters, which is abnormal. We also know there's increased creatinine kinase, so there's a muscle issue going on there as well, okay? So, what is Cory's disease? Well, as we said, it's a mutation in the debranching enzymes, okay? So this normally liberates glucose from glycogen branch points, okay? So you cannot fully break down glycogen, okay? So that's why episodes of hypoglycemia as well. You also get accumulation of certain glycogen remnants, or what we call dextrin-like products that accumulate in these cells, okay? and that leads to hepatomegaly, hepatosplenomegaly. We talked about why patients get hypoglycemic, okay? And then also you have damage to muscle cells, because remember there's glycogen in muscle as well. So that's why this patient also has elevated creatine kinase, okay? If we take a look on the next slide, Sean has gone ahead and pulled up a table that nicely summarizes the various glycogen storage disorders, okay? You can see there the third row, Cory's disease, an enzymatic defect in the debranching enzymes. You can see that our patient had almost all of those. He had hypoglycemia, hepatomegaly. I don't know if they talked about fatigability, but we do know there was muscle wasting, especially with the elevated creatine kinase, okay? So hopefully you guys can see, I'll leave this here as well. We'll kind of run through the other answer choices. So myophosphorylase, that leads to McArdle's disease, and that usually presents with muscle cramps, fatigue, myoglobinuria, and we weren't told that. We were told that there were just ketones in the urine, okay? And nothing about muscle cramps, nothing about this getting worse with strenuous or prolonged exercise. Branching enzyme, I guess I'll go going upwards. Lysosomal acid maltase, that would lead to Pompe's disease, and that's more with cardiac issues, so hypertrophic cardiomyopathy, exercise intolerance as well, and hypotonia, so low muscle tone. We weren't really told that in this vignette. Glucose 6-phosphatase, a deficiency in that would lead to von Gierke's disease. So this is a little bit tough. It's on the differential with Cory's disease. It's a little bit more severe. So you get increased uric acid levels, increased lactate levels, and that's what's also very dangerous about von Gierke's as well, okay? So a little bit different phenotype than Cory's disease, close in the differential. And then lastly, branching enzyme, and that would lead to Anderson disease, and that usually presents in infants with hepatosplenomegaly and not patients being unable to thrive. So different age demographic here as well. So a very tough concept, but these glycogen storage diseases and disorders are very high yield. Hopefully this was a helpful review, and great job on this question as well. And one more question to go.
Excellent. Thank you, Paras. A quick mnemonic here if you want to jot it down. It's ABCD. Anderson's branching enzyme, Cory's debranching enzyme. All right. When in doubt, just go to the alphabet. All right. ABCD, Anderson's branching, Cory's debranching. Now, let's go ahead and move on to our last question of the evening. As you can see, the answer choices are covered up, and we will begin with the lead-in. This is our last question, so let's try to finish strong. From which type of blood vessel did the investigator likely isolate this type of hemoglobin? From which type of blood vessel did the investigator likely isolate this type of hemoglobin? I'll give all of you a few moments here to let us know in the question box how many steps you think this will require before we move on. All right, I see the responses coming in. Let's go ahead and read that vignette. A researcher is performing molecular analysis on different forms of hemoglobin drawn from various blood vessels. The researcher isolates a type of hemoglobin in which the molecules alpha-1 or A1 and beta-2 chains are tightly stabilized by salt bonds. From which type of blood vessel did the investigator likely isolate this type of hemoglobin? Once again, start thinking about those relevant clues in the vignette and lead-in as I hand it off to Paras for our last question of the evening. Paras.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And this is our 4th time doing that. So hopefully you guys are starting to get a sense of what we think are important to highlight and maybe what's not as important, so that when you go back and look at the question again, you kind of have really just highlighted what you really only need to. And you're not wasting time looking over maybe not as relevant information, okay? And so let's go ahead and do that again with this question. So this question is now asking us kind of an experimental question, and you will see various types of questions like this on step 1. So they're asking us about different forms of hemoglobin from various blood vessels, and then this researcher actually isolated a specific type of hemoglobin in which the alpha-1 and beta-2 chains are tightly stabilized by salt bonds. So then they're asking us, well, which type of blood vessel was this isolated from? Okay, so probably how many steps is this question? Well, I think a little tough without going too much in depth, but I think we need to figure out maybe what was that type of hemoglobin, like what are they getting at, you know, when they're saying type of hemoglobin? And then 2, where could we maybe find that in the body, in the circulation? So maybe a 2-step question here. So let's go ahead and take a look at the answer choices. And once again, we will start at the bottom and we'll work our way up to the top. Answer choice E, pulmonary veins. D, peripheral capillaries. C, femoral arteries. B, coronary arteries. And A, alveolar capillaries. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
All right. Last question of the evening. We'll give all of you a few moments here until about 2/3 of you have responded. And then we'll go over the correct and incorrect explanations. And of course, at the end, we do have a raffle and special offer. You must be present to win, so make sure you stick around. Next week's topic, for those of you who are wondering, is renal physiology. All right, I see the responses coming in. A few more moments here. All right, well, let's take a look and see what all of you selected. Looks like it was close. 28% of you selected peripheral capillaries, 26% of you selected alveolar capillaries, and 25% of you selected pulmonary veins. So let's take a look and see what the correct answer is. And the correct answer is D, peripheral capillaries, and 28% of you got it right. So once again, a challenging question. Let me hand it off to Paris so we can make it easier for us. Paris.
Thank you, Sean. So once again, definitely a tough question here. So let's see what's going on. So if you take a look at the next picture, you can see that there's this picture here of hemoglobin, and you can see, well, you know, in general, hemoglobin can take on one of 2 main configurations, okay? Depending on whether the molecule is in a high oxygen environment or a low oxygen environment, okay? So this tetramer, 4 parts, this tetramer that makes up hemoglobin, it consists of 2 alpha units or 2 dimers, and you can see there's alpha-1, alpha-2, and then beta-1, beta-2. Okay, so the 2 dimers are alpha-1, beta-1, and alpha-2, beta-2. Okay, so what holds these dimers together? Polar bonds. Okay. And this hemoglobin can assume either a taut, T-A-U-T, taut form, or a relaxed form, okay? Depending on whether the molecule is oxyhemoglobin or deoxyhemoglobin, okay? So the T form, the taut form of hemoglobin, is the deoxygenated form, okay? So in that case, you have many polar bonds holding these alpha-1 and beta-2 chains together when hemoglobin's in a low oxygen affinity state, okay? This is the reason this is because it's trying to get rid, trying not to absorb hemoglobin in these deoxygenated areas, okay? In contrast, the R, or the relaxed form, there are less of these bonds, the chains are less tightly joined, and oxygen is more able to bind. And you would want that in an area that's of high oxygen concentration so that it can bind to the hemoglobin. So if you take a look, that T or taut hemoglobin would predominate in an environment with low oxygen. Of those, the only one there that's really a low oxygen tension is peripheral capillaries, okay? That's where hemoglobin releases oxygen to the tissues, okay? Pulmonary veins, that has a high concentration of oxygen. It just came from the lung bed, okay? So it's carrying oxygenated blood. Femoral arteries, that's blood that's very proximal to the heart. It was just pumped out from the heart, okay? So oxygenated blood. Coronary arteries as well, the blood vessels that are feeding the heart coming off the aorta, those are also very oxygenated. And then alveolar capillaries as well. So the capillaries feeding the alveoli that are about to absorb a lot of oxygen from the alveoli, okay? That would want to accept oxygen, so it would be in a relaxed form, okay? So not very tightly bound. So hopefully you guys, one, are able to see that, you know, knowing that respiratory physiology and hemoglobin binding, how this is the best answer. But two, if you didn't know that, you also hopefully could have picked up on that, you know, peripheral capillaries are the only one there that's a low oxygen environment. The other ones are all high oxygen environments. So definitely some tough questions today. That's par for the course with biochemistry, but great job tonight.